Well, hello everybody, and welcome to UKMFA TV. This is our podcast channel on TV and audio, of course. And what better way to start 2026 but with one of our directors, the lovely Dr. Sarah Myhill.
Welcome to another broadcast by the UK Medical Freedom Alliance, the UK's most recognised and respected organisation advocating for every individual's right to informed consent, bodily autonomy and medical choice. We are the UK's voice of ethical medicine.
Usually when we're doing our podcasts, there's usually something quite miserable that we're talking about, and we're a little bit down, and because there's so much that we have to tackle, and but this time we're going to start the new year with a good news story, and it's all to do with you, Sarah. So welcome to the podcast. Thanks for coming along.
Oh, bless you, Ian. You're so kind. I'll tell you the background of the story, which is that I am the most investigated doctor in the history of the General Medical Council. I now know why it is investigating me continuously. It's because I'm a thorn in their side. The GMC, together with the other regulatory government quangos like the national, the MHRA and the Department of Health, it's all about controlling doctors' opinions. And the reason I'm such a thorn in the GMC side, and I want UK Medical Freedom Alliance to be an equal thorn in the GMC side, is because I am going against the narrative. And the narrative, of course, with COVID is that is not scientifically based and is not good for patient safety. So we know that the COVID pandemic was no worse than a normal flu epidemic and could have been treated with all the usual regimes we use to treat flu, good naturopathic medicine. We know that the COVID jab rollout is not safe and was not effective. And what forced doctors to give these jabs and what forced patients to accept them was coercion. And that involved a complete rejection of the General Medical Council's obligations to uphold ethical standards. Now, I have pointed this out endlessly to the GMC. So what happened at the beginning of this year, a week ago, was yet another fitness to practice hearing, essentially saying that I was acting outside my area of expertise by advising an acquaintance about the death of a patient in hospital. And I won that hearing. I won that hearing because, my private and confidential letter was used without a knowledge or permission. Again, the GMC should not even have launched this investigation with that knowledge. But of course, the GMC being the GMC, anything to put Dr. Myhill down, they will do. And secondly, I detailed at length the ways in which this patient had been mistreated. She had been and essentially we had a fit and healthy 84-year-old lady who was dead in 3 weeks. Why? Because the diagnoses were missed by the GP and were missed by the hospital doctors. Now, I don't want to go into that at length because the details are a bit tedious, but it illustrates the points that the GMC will come after any doctor who steps outside the narrative. So they are not investigating me because there's a really good case. They're investigating me in order to silence me. So the fact that I've won this investigation, what that means is that I'm in a much more powerful position to flag up the deficiencies of the General Medical Council. So as I pointed out to the GMC at one of my hearings, the GMC is the oldest regulatory body in the world. It was established in 1858, and had I been its doctor and the GMC my patient, I would have diagnosed senile dementia. Okay, you might think that's a poor joke, but the fact is, it's absolutely true.
I think we're in the mood for joking about them right now because, to be honest, they should be disgusted with themselves and quite embarrassed, I would have thought, because now this is, for you, 46-0 that you've won this match, which is quite a significant win, I would say, overall. And, so I don't know how they can live with themselves with that.
Well, because the GMC aren't about living with themselves. The GMC are bankrolled. They get large money from Big Pharma. They get large money from the Department of Health, in order to pursue, the policies that generate big income for Big Pharma and look after big government as well. But the GMC should not be about that. I mean, the GMC's overarching principle is to protect patients, and that is what they are not doing by not allowing doctors to give their medical opinions freely, and by failing to uphold their own ethical standards of behaviour and consent. They are in complete breach of the Hippocratic Oath.
It's almost echoing all the other free speech problems that are circulating in the world right now, isn't it? It's not just the medical profession; it's everywhere right now, and they're just another organisation that's just gone into this world where they're going to say, right, we're just going to cancel people, we're going to not let them speak, and we are going to demand that you follow this particular narrative, and that is it. And if you fall outside of that narrative, we're going to prosecute you.
Correct.
Yeah.
That is exactly what it is. And the awful thing is, an old retired, doctor like myself, who doesn't have a young family to look after, I can step outside the lines. I can take action. But any young doctor, any doctor who's in the system, who is within the NHS, dare not. They dare not speak out, because if they are sanctioned by the General Medical Council, they lose their professional reputation, they lose their licence to practice, they lose their job, they lose their financial security. They put the survival of their whole family on the line. And so doctors are effectively handcuffed. They are in a straitjacket. They only dare come up with the government narrative, and that is not good medicine, because the first principle of the Hippocratic Oath is make the patient your first concern. You have to do whatever is best for that person sitting in front of you, even if it means taking risks. And I know many doctors who privately say, there's no way I would take the jab, but in their everyday practice, they are being forced to roll it out. And there are many brave doctors like Dr. Sam White, like Dr. Daniel Armstrong, like Dr. Anne McCluskey, who have spoken out against the vaccine, have spoken out against the jab. It's not a vaccine, it's a jab, it's gene therapy, and they have been struck off as a result. And they are without jobs, they've lost pensions, they've lost financial security. It is a shameful way to treat these wonderful doctors who are simply doing their best for the patient. And it's about time we took a stand, and it's about time that the GMC was held accountable for its outrageous stands.
Yeah. So let's maybe we could just run through how your case got introduced to the GMC, just this particular one, because it's just as an example, because I'm hoping there's going to be people watching these videos that aren't medical. They're just like me. They're just an ordinary person, ordinary lay person. And we as lay people need to understand how our doctors are being dragged into these hearings and into these processes.
Okay.
And it seems there's no triage actually on a case coming in for them to make a decision early to say, actually, this is not something we want to deal with. So,
well, I mean, there is supposed to be a triage, but of course, whenever my name comes up, with the GMC, there is some. I can only think that there is some agenda within the GMC that's out there to silence me. Now, the reason I won this case, despite the GMC being both my prosecutor and my adjudicator and judge, the reason I won is because the GMC knew full well that if they sanctioned me, I would take it to the High Court and they would lose. So I had a very powerful case. I represented myself.
So how did the process start? So you've written a letter, which you've done in all good faith, to someone who is associated with you. It wasn't in your professional capacity, and you were not acting as an expert witness in terms of this particular case.
Well, I mean, it was a private letter. It was a confidential letter sent to somebody to explain how it was that their 84-year-old member of the family, who was completely fit and well, was dead within 3 weeks. And I sent a very detailed, biologically plausible explanation for why this happened. Now, this patient was immunosuppressed for reasons of thalassemia, glucose 6-DP deficiency, hyperferritinemia, hyperglycemia, and vitamin D deficiency. So, any half-decent doctor should have recognised that this patient was at risk, was immunosuppressed, and was at risk of infection. But all these details went unnoticed by the general practitioner and unnoticed by the hospital doctors, despite the patient herself flagging these up. And then that was compounded by the doctors failing to diagnose. Now, this patient presented with sciatica. Now, sciatica is not a diagnosis, it's a clinical picture. We have to ask the question why. Why does that patient have sciatica? She'd never had back pain before. And with those, serious, diagnoses that she already had, that should have engaged the diagnostic brain. Those doctors should have thought, well, this is very peculiar. Perhaps it's not just degeneration, and if it, perhaps this is severe pathology. And at the very least, they should have thought, could she have a collapsed vertebra? Could there be a secondary deposit in her spine? Could this be, and there could be a serious pathological reason for this. But instead, this patient was prescribed symptom-suppressing medication. Now, symptom-suppressing medication is always dangerous because it takes away the symptoms, and symptoms are our guide to diagnosis. And in parallel with that, much symptom-suppressing medication is immunosuppressive. So she was given non-steroidal anti-inflammatory drugs, big dose of naproxen, which is immunosuppressive. She was given large doses of diazepam, which is immunosuppressive. She was given doses of gabapentin, which is immunosuppressive. And what this meant is that her symptoms were initially controlled. Her underlying abscess went undiagnosed until it was too late. And then she died of septicemia. And even her process of dying was not even noticed in the hospital because she developed a hemolytic crisis by dint of having glucose 6-DP deficiency, by dint of being on these high dose of drugs. So her hemoglobin fell from 107, which is pretty low, to 70 over a few days. That is a hemolytic crisis. It wasn't even noticed. Whilst she was in the process of this hemolytic crisis, she was continued the prescription of all these 3 immunosuppressive drugs. I mean, it's not surprising she died.
Please consider donating to the UKMFA. We are really grateful for all donations, no matter how small. Your donations enable us to continue to lobby for your right to informed consent and medical freedom to be upheld, and to provide resources to educate and empower the public. There are multiple options for donating. One is that you can scan the QR code that's on this video right now, or you can go to the link that is featured in the description below this video, or you can go onto our website and contribute via donor box, or you can buy us a coffee.
Anyhow, I explained this in my letter to my friend, and I thought that was that. Over a year later, I then heard from the General Medical Council. I then discovered that my letter was used by the coroner without my knowledge, without my permission, without my consent. Now, that is a failing on behalf of the coroner because any such a letter should be used and the provenance of such should be established. He used it as the basis of his cross-examination of the doctors that were involved at the inquest. And then, when the cross-examination didn't go their way, he thought, let's have a look at this letter, noticed I'd been suspended from the GMC and reported me to the GMC for acting outside my area of expertise. I mean, the whole thing is a nonsense. It should never have come to a fitness to practice hearing. But again...
Well, I think also, because you'd written that letter, you should have been called as a witness in that coroner's hearing, right?
Of course,
and I would have been in the coroner's call.
I'd have been delighted to turn up, not as an expert witness, not as a witness of evidence, but as a witness of, well, this is what went wrong. Because it's very clear from that coroner's cross-examination of the doctors that the coroner didn't know what was going on either. No. Again, the coroner himself, and I have to say, I still wake up in the night shaking my head thinking this cannot be right. This coroner, this patient had a hemolytic crisis. when the GP it was asked what is hemolysis, she said it's a clotting. Well,
Right.
that is a fundamental incorrection. This is nonsense. It's a factual. I mean, if I was asked that at my finals exams and said, "Oh yes, I think hemolysis is a clotting," I would have failed. I'd have failed my exams miserably. For doctors to believe that hemolysis is a clotting just illustrates the level of ignorance under which many are working. But it's worse than that. The coroner, instead of correcting her, he thought that was right too. There were other doctors present at that hearing, and they didn't correct that either. So the whole inquest was a charade. And I illustrated that, and this whole hearing occurred. It was in the public arena. The transcript will come available. Anybody can see that, what was said and the exchange that took place. But it illustrates that inquest was a charade, and I have recommended that my acquaintance take this further because this is very poor medical practice, and that's what should have been reported to the GMC. The doctors involved should have been reported to the GMC, not me for flagging it up again.
And the coroner, I would say, because a coroner is a senior physician, aren't they?
Well, they can have a medical or they can have a legal qualification, as I understand things.
Okay.
And this coroner obviously didn't have a medical qualification, or I hope he can't believe he did. Again, I asked the coroner to attend my hearing, and he refused. And again, I point out to the GMC, it's not within his right to refuse. If I ask a witness to attend, it's not for the witness to say, "Oh no, I'm not going to turn up." I mean, in the event, there was no time for me to issue a witness summons. But I tell you what, had I lost this hearing, then the coroner would find himself in deep trouble just from me.
Sure. Yeah. Unbelievable. So having then reported you to the GMC, they've got to then provide some evidence, I would assume. So and the strength of that was just the letter that you'd written.
Well,
correct?
they commissioned an expert witness report, and of course I had the joy, the pleasure of cross-examining this expert witness, and of course I made a fool of him. I mean, he was probably a very nice, person, but his hands were shaking throughout. I cross-examined him for 4 hours and pointed out exactly why he should never have used my private and confidential letter and perceived it as an expert witness report. And say it failed what I call the duck test. I mean, we all know what the duck test is. If it walks like a duck, if it waddles like a duck, if it looks like a duck, if it quacks like a duck, it is a duck. He should have immediately been able to recognise that private letter was not an expert witness report. There was no letter of instruction. There was no statement of truth. I didn't reference anything I said because it was a private letter. I didn't need to reference anything I said, and other such examples. So, he proceeded on supposition. That is not the job of an expert witness. The Royal College of Physicians clearly states that expert witness reports must be based on fact, not supposition. So that was the first big problem for him. The second big problem is he then tried to defend the actions of the GP and the hospital doctors and, of course, the coroner by saying that they were reasonable. Now, of course, I was easily able to shred the GP evidence because, I am a GP. But another fascinating issue occurred here because when I started to shred the hospital treatment of this patient, the panels told me, "Oh, I'm not an expert in hospital medicine, and therefore I'm not allowed to opine on this." But the GMC's GP expert witness said the hospital treatment was satisfactory. So my view is if he's allowed to opine on the hospital treatment, then I'm allowed to opine on the hospital treatment. And guess what? Hospital treatment is merely an extension of what should happen in general practice. Okay, I wouldn't dare, opine on, spinal surgery or orthopedic surgery, not my area of expertise. But even I can see that patient was in renal failure. She had an estimated GFR of 19. At that level, she should have been on renal dialysis, not prescribed high doses of renotoxic drugs. And the chairman of the panel tried to shut me down. She consistently said, "Oh, can you move on with your questioning? Can you move on with your questioning?" And I said, "No. This GP expert witness is giving me replies, but not answers. And those are two different things." I ask a specific question, do you agree with me that the hospital didn't notice that the hemoglobin fell from 107 to 70 and therefore that was a hemolytic crisis? He wouldn't answer that question. He just went off at a tangent. So although he replied to what I said, he didn't answer it. They're two different things. And the astonishing thing is that the chairman of the panel didn't seem to get that. She didn't seem to understand it. And again, that was a source of huge frustration because it meant I couldn't advance my case why, I perceived that the GP and the hospital management was inadequate. So again, it just illustrates the poor quality of expert witnesses and members of the panel when they're not allowed, the normal logical process to develop.
The best place to find our content is on our Substack. That's at substack.com/@UKMFA1. That's substack.com/@UKMFA1. You'll also find us on Rumble, YouTube and Odyssey in video format, and also on your favourite podcast in audio format. We tend to use Apple and Spotify, but of course you'll find us in lots of other places too. We publish everywhere. You'll also find us on the mainstream media and alternative media too. So look out for us on your favourite channels. And don't forget, like and follow at every opportunity. Thank you.
But you don't have to be an expert to notice that figures that have been obtained from a blood test, from a scan, whatever it might be, are telling you something, are at a certain level.
Exactly. I mean,
Right?
another example.
I could probably notice it, to be honest. If someone said to me, hemoglobin's supposed to be this, and they show me a chart and I say, oh, it's only 60, that can't be right, can it?
Correct.
Hello? Right?
Correct. But the point here, Ian, is they were using this excuse to shut me down. You're not expert in hospital medicine, so you can't opine on the hospital treatment. And I said, nonsense. Of course I can. I'm a general practitioner of 40 years experience. I have every right to say these things. And furthermore, the family has every right to know. Because what that trial illustrated is that the GMC is not there to protect patients. This trial was all about protecting doctors. I was on the attack against them, and the GMC was trying to defend the hospital, defend the GP actions, defend its own GP expert witness, and defend the coroner. The patient, wasn't our silent witness who died. Her voice was not heard. It was only me and my friend who had reported this case to me who was speaking up on behalf of that silent witness. So the GMC is not acting for the overarching benefit of patients. It's acting to protect itself and to protect doctors who I believe should be further investigated.
Oh, absolutely. And if you were a GP in your surgery and you had done those tests via, or sent someone for tests and then got those results back, then your opinion, are they saying then you can give an opinion, even though the results are exactly the same as the ones that you would see in the hospital? It makes no sense, does it, at all?
Of course, but this whole charade is illustrative of the fact that the GMC now makes very little sense at all. It's not functioning for the overarching benefit of patients, and we have seen that as illustrated by the COVID nonsense. And the crime now that we really must move on to, and I know UK Medical Freedom Alliance is going to be a major part of this, is we need to flag up how the GMC is now failing to maintain the Hippocratic Oath. It is failing to protect patients by not allowing doctors to give informed consent. And the Hippocratic Oath, or good medical practice, clearly states that for any medical intervention, you must give proper informed consent. Now, must is a legal imperative. What that means, if you don't give it, you are breaking the law. And so every patient in this country, every person in this country who has received a COVID vaccine without proper informed consent, and that's the overwhelming majority, has been the subject of a crime. Because every time a jab is administered, that patient has to be given the evidence that it's safe, the evidence that it's effective, the right to refuse with no coercion, and information about alternatives to that jab. None of those things have been done. That is a crime. And that is something that we have to take the GMC to task for. Now, I'm currently obviously looking at the legal scenario, and it's quite clear that the registrar of the GMC is legally, ethically, and morally responsible for upholding ethical standards. And that has been and he has failed to do that. The registrar of the GMC is Charlie Massey. He's been there since 2016. Guess what? He came from the Department of Health with all the Department of Health and NHS England's narratives. And these have been imposed upon doctors with no consultation and against their will. And so doctors have been coerced into supplying these COVID jabs without proper informed consent. And that essentially is a crime.
Right. And as a crime in the sense that it actually breaches criminal law as opposed to civil law. Is that correct?
I believe so. I don't know. I believe so. And I think we have to, and similar actions are taking place, I understand, in Australia and in other countries.
Yeah.
But there has to be some political will behind this. And the political environment, I think, is now swinging in our favour.
Right.
So I think we have a very powerful case. I think UK Medical Freedom Alliance will be at the cutting edge of this. Once I have drafted the case, I will then enlist the support of other organisations like Heart, like the COVID skeptics, like the Freedom of Speech Union, and we will drive this forward because this is absolutely essential for patient safety now and in the future.
Wow. Because obviously some crimes have been reported to police by certain groups and they've got absolutely nowhere. And we think we know why that has happened. I just hope that we're not going to find ourselves in a similar position. But the case is strong and we keep telling the public about it. I think it's public opinion that's going to swing these things, because that's what's starting to move, I think, the powers that be to think in a slightly different way, because they keep running up against the public who are far, far more aware now than they were 5-6 years ago.
Correct. The public have woken up. And the public, quite understandably, want answers. And it's the General Medical Council that is responsible for maintaining medical ethics. And they have the powers to destroy the lives of doctors. And they have been using these powers totally unreasonably, totally unfairly in their attempt to control medical opinion and medical thinking. And that is just wrong.
Well, the great news in this case is that you've won this one, which is something to celebrate. And it's put a big smile on our faces to start the year. And hopefully there's going to be more. I know you've got another one that you're trying to get in front of the European Court of Human Rights.
That's on its way.
Yeah, so let's see how that one goes, because if you win that one, that'll be 47. And I mean, it's crazy, isn't it? You'd think they would give up by now. I mean, if you were a football team, you'd be ashamed.
I'd be first division anyway.
Absolutely. Oh, I think you'd be top of the Premiership at the moment. I mean, I think you'd be leading the World Cup team, I think. It's absolutely amazing. I mean, all power to you. I mean, your fortitude and courage is second to none. And the world needs people like you, Sarah, because without people like you, unfortunately, I think we'd be in a very bad place. So thank you on behalf of us all, especially the public, because, as you say, they're the ones that aren't getting the support that they really need.
Thank you, Ian.
So it's great. Is there anything else you want to talk about in that sphere? Because I was going to ask you to maybe comment on the Reform Party's latest candidate that they've taken in. Did you see that Nazim Zahawi is now joining the Reform Party?
That's very sweet of you to ask me. I'm not a politician. I just don't know. I'd hate to opine on an area in which I'm not expert, but I hope that, should reform get in, then this will assist our campaign to promote freedom of speech. And if that happens, then I should be delighted.
Well, that would be good. It's not really political in the sense that Nadhim Zahawi was the minister that basically drove the jabs around the country and was put in charge of the nudge for people to take the jabs. And he's now joined the Reform Party. And apparently, according to Nigel Farage and the rest of the party, everything is all forgiven. And what a wonderful job he did, because he was fantastic at logistics, and got these jabs out faster than anyone else in the world. And what a fantastic, brilliant job he did. So, well,
Well,
that's a watch this space.
the point is, he was just an enabler, but he was misled by the General Medical Council, the MHRA, NHS England, and the Department of Health. And
Yeah.
those are the people we need to go for. The people at the top who made those terrible decisions, say in breach of the Medical Act, the Hippocratic Oath, and all ethical and moral concerns.
Yeah. Okay. Well, I'm not going to keep you any longer, because we've had a nice half an hour, and it's perfect timing. I'm so grateful for your time, and look forward to seeing you again very, very soon. And yes, I'm sure we'll be chatting offline anyway.
Thank you.
And good luck with everything. And let's go for it. We've got a year that's going to be extremely interesting by the sounds of it.
Yeah. Life will get more interesting and more fun, I hope.
I hope so too. Yeah. Right. Well, thank you so much, and thank you everybody for watching. And please do like, subscribe, etc. of what we usually do with our videos, and keep a lookout for these new special reports regarding medical ethics. And we're going to keep pushing these through the year. More and more interesting guests, and some success for UKMFA, even more than we've had so far. So thanks very much, and see you all soon. Thank you.